And I'll recognize myself for questions. Mr. Reese, how does having to comply with disparate federal regulations impact the states? What kind of burden does that impose on the states?
So, as you can imagine, in most areas of state government, we have to be very cautious with the money that we have and how we spend it and what we do with it. And the challenges that we have is with these resources that we have to dedicate to compliance and cybersecurity, we're finding that we're having to put, as someone else here I believe had pointed out, we know that about 43% of our resources within our compliance and cybersecurity are being utilized to our federal compliance, where, again, we're all for federal compliance, and we absolutely want to be following the laws because we need structure. But our challenge is that we're having to spend so much time and so much duplicative time because of the multiple audits. Again, when we're having the same audits over and over again, and the fact that there's some differences that we have to go out and try to map, as we had showed before, we've got to determine what the least common denominator is across those. That is so the time constraints are just enormous. The amount of time that we spend, the thousands of hours, we know. We spoke with several of our other states, and we were able to log that in a single year, Oklahoma spent over 10,000 hours in regulatory compliance, Maine spent over 11,000 hours, and Kansas over 14,000 hours just in our compliance and audits. Colorado itself had nearly 3,000 hours. And so all of that is time and resources. And those resources, especially in days like we have today with cybersecurity being really a #1 challenge for all of us, that we'd rather be spending our time and efforts updating legacy systems and trying to enhance our security posture rather than trying to meet some of these, in many cases, outdated regulatory compliances.
I ran a state-based think tank for 24 years and worked very closely with state legislators and administration officials across, I think, 4 or 5 governors, and I became very aware of the cost imposed on the states and the inefficiencies from duplicate regulations, obsolete regulations, extremely overly complex regulations. It wasn't that the states weren't interested in complying. It was, in many cases, they didn't know what complying meant, and we spent an enormous amount of money. Mr. Rigi, it's interesting in your testimony you talk about what's going on in healthcare and how the patient-physician relationship is impacted by overregulation. One example of that would be ICD-10, where basically you've got doctors that are compromising time with patients, or their time with patients compromised because now they become data entry people. Would you like to comment on that?
Well, again, first I'd just also like to clarify for the record that the AHA does understand the necessity of regulation to provide safety and high-quality care for patients. Again, the implementation of ICD-10 does require a significant amount of physician time, and I think for us to make sure we give you the most accurate response, it would be better for me to provide you a written response on that one, sir.
That would be fine with me. And one of the things that I introduced a bill to postpone the implementation of ICD-10 primarily because I grew up in a rural area. I grew up dirt poor, basically, in a house that had cardboard between the 2 befores. And at the time I grew up, we did have a little doctor in a town that didn't even have a traffic light. You won't find that anymore. And one of the things that I saw happening with ICD-10 was made rural health care even harder to provide. Literally, doctors were selling their practices, or they were just flat out retiring, shutting the door. And that's an example of how over-regulating can have a very negative impact, particularly in these rural healthcare settings where they're already undercapitalized. It's also impacted wait times. And like I said, the amount of time that a doctor is able to spend with a patient. And if you want to see what over-regulation of a healthcare system looks like, take a look at Canada. The Fraser Institute published a report. The Huffington Post commented on this that showed that between 1993 and 2009, there were between 25,000 and 63,000 women died on waiting lists waiting for treatment. The wait times have increased that much. I want to ask, they've just called votes I'm going to go ahead and ask a couple other questions here for before we recess. But I want to go back to Mr. Reese and ask you, how do the federal regulations keep pace with the evolving technology and the business models across state governments?
They do not. That is
what I thought
our
you'd say.
challenge is we find ourselves in a lot of cases when we're dealing with our regulatory compliance, we're actually dealing with third-party auditors. And the third-party auditors are coming in and doing different audits, getting different results on the same regulations, on the same systems, and the technologies that they're auditing us on are not consistent. Their understanding of the technologies are not consistent with the technologies that we're using today. And in some cases, they're limiting our ability to use what we would believe be more cost-effective, efficient, and possibly even more secure technologies because we can't check the box with the auditor. So we have to go back and spend more money using older technologies, costing the state more dollars than if we could actually make good business decisions. And a lot of that just has to do with those federal regulations need to be able to keep up. We need to figure out how we can harmonize and be involved in those discussions and decisions and how we can do it quicker so that we can keep up with evolving technology. But your point is absolutely spot on.
Well, what I've found, again, working with the think tank, is that the people who are responsible for regulating are not people who are trying to mess things up. They're trying to do a good job, but they're as frustrated as everybody else because, you know, you call one regulator and get an answer, and 2 or 3 weeks later you call another regulator and you get a different answer. And it's frustrating to them because they want to do a good job. Mr. Feeney, I'm going to ask this question, and we're going to take a recess to go vote. But how much does it cost the financial institutions to comply with disparate regulations? And I'm interested in this because this additional cost gets passed on to consumers, and I think it has a disproportionate impact on older customers and lower income customers.
Right. So I can't speak to the specific aspect of that. I can tell you in 2016, the industry spent $9.5 billion on regulation. $1.5 billion of that was spent by the largest firms.
According to the report that Mr. Raskin said came from OMB, I think he said that the regulatory cost was only $5 billion, but you say the regulatory cost on the financial institutions was $9 billion?
In the industry, across the industry, and that was a single-year view. The challenge is more, and I think Mr. Reese had referenced it, is that our industry, they're trying to keep up with the changes in technology, but you can't. It's just too fast-paced, too hard. We were able to use that sector profile, for instance, and take the question set down to about 400 from thousands. And what that does is provide you some latitude in simplifying the diagnostic statements that auditors or examiners would use. And there are ways to actually apply these types of tools to help the regulators, help the industries, I say that plurally, to really minimize the cost. And I think there are a number of things we can do in that arena.
Okay. Hold on. I'm going to